thank you so much for joining us today. We'll start this trip by looking at the slideshow, and we'll show some of the incredible work that has been going on in response to the COVID-19 pandemic, as well as the flooding caused by Hurricane Eta. I'll ask Ian, who is managing the Zoom call, to start the slideshow. Thank you, Ian. My name is Samantha, and I'm the Executive Director of Food for the Poor Canada. Thank you so much for joining us from Canada and Jamaica and anywhere else in the world that you are. It is so great to see some familiar faces, and really appreciate the work that Food for the Poor US and Jamaica have done to make this event possible, as well as Heli in Canada. We're going to try and do these virtual events every few months, and we will tell you more about the next ones in 2020. But today, I just want to say that I'm missing many of you, seeing you in person and being able to, to give you hugs, and so really nice to see you here today. Thank you for coming. Housekeeping events. The event is being recorded, so if you're uncomfortable, please turn off your video. Everyone will be muted during the event to eliminate any background noise. If you'd like to make a comment or a question, type into the chat box at the bottom, and Heli will be keeping an eye on it for us. We are asking you today to donate to provide meals and PPE to the people of Jamaica, and we will have instructions up on the screen over the course of the recording. For Jamaicans, we'll ask you to go to the Food for the Poor Jamaica website, foodforthepoorja.org, and for Canadians to foodforthepoor.ca. We have a few pre-recorded videos. Again, when we're showing these videos, please turn off your video to enhance the playback quality. These are turbulent times in Jamaica, and Jamaicans are facing a triple threat of poverty, the pandemic, and the aftermath of flooding from hurricane. My dad, who just turned 78, says he had never seen so much rain in his life and so much damage to the roads and the infrastructure. So it's really a triple threat. We're going to hear from people on the ground in Jamaica who, because of your generous donations, are able to make a tangible impact around the island. I hope that you will come away inspired and hopeful about the positive impact you can continue to have on families and in communities. I'm going to ask Yvette Silvera, the co-executive director of Food for the Poor Jamaica, to open our mission with a prayer. Thanks, Yvette.
Good day, all. Let us pray. Touch us, O Lord, and fill us with your light and your hope. Please give us strength when we are weak, love when we feel forsaken, courage when we are afraid, wisdom when we feel foolish, comfort when we are alone, hope when we feel rejected, and peace when we are all in turmoil. O Lord, with humble hearts we pray thy blessing this day and ask that where grateful folks say words of grace, that thou will come to share the yield that you have provided to our farms and fields. We pray your love will bless each heart and each home. Father, we thank thee for health and food, for love and friends, for everything that you have provided us, Lord. Father in heaven, we thank thee. Amen.
Amen.
Thank you for joining us here in Jamaica. We're honored to have you visiting us virtually. And we're thrilled to be able to take you on this mission trip, thanks to Food for the Poor Jamaica, Canada, and Food for the Poor US. You're about to hear from Suzanne James, who is presently working remotely from our Jamaica office. Suzanne has been with Food for the Poor for over 20 years, and here she is to provide an overview of what Food for the Poor has been doing and the situation in Jamaica during the pandemic. Take a look.
My name is Suzanne James Casterly. I'm a project manager from the Florida office, currently on assignment here in Jamaica. I'm here during the midst of the coronavirus pandemic, and I just want to share with you how critical your support is to the people of Jamaica. Here in Jamaica, it's challenging for many individuals to be able to make a living for their family in the best of times. This crisis has multiplied that. A lot of elderly that are desperate, a lot of individuals that may not even have met our criteria for support that are now suffering from hunger. The government has asked for the population to stay at home, a phrase that we call here in Jamaica, tana ya yard, stay at your yard, for the safety and security of everybody that's around you. It's only essential services like Food for the Poor that are able to go out into the field and go to our places of business so that we can make sure that the country does not suffer irreparable harm and the individuals are not suffering too much. Food for the Poor is called to help the churches, to minister to those that need it the most, to be able to not turn away somebody because they don't have enough food, but to be able to go to them and say, this is what God has provided for you. This is what the donors from Food for the Poor has provided for you.
Thank you, Suzanne. We really appreciate that input. And Food for the Poor Jamaica has been working closely with community leaders to understand the most urgent needs, community personnel, the community leaders who are on the ground, on the field, on the front line, trying to help those that are in desperate need. The most urgent needs of the communities are, especially at this time during the COVID-19 crisis, here to give us an overview of the needs that are there and the realities that the people of Jamaica face is Errol Green, the Regional Director of the Western Region Health Authority, which covers the western side of Jamaica, the western side of the island. And he has been in charge of the health sector and is able to give us a quick overview as to the challenges that are being faced, particularly as we go through and not having a tourism sector to rely on at this point or at this time in Jamaica. Thank you. We're in the beautiful parish of St. James, Montego Bay, and we're here with Mr. Errol Green, the Regional Director of the Western Region Health Authority. Now, this region covers how many parishes, Mr. Green?
4, Trelawney, St. James, Hanover, and Westmoreland.
Wow, that's a lot of health centers to deal with and hospitals, right?
About 88 health centers, 4 hospitals, including a regional hospital.
Wow, what has it been like since the pandemic has come in for you guys?
It has been stressful. Mm-hmm. It has been challenging, but we have a tremendous workforce, or doctors or nurses or public health professionals or maintenance persons,
Right.
our officers in the regional office.
Right.
Everybody recognize the challenges and we pull together as
Yes.
a team to face these challenges.
Wow, and we take our hats off to you.
Thank you.
But some of the challenges that you're experiencing, because we know, I mean, these workers are on the front line.
Yeah.
There's a great need for many items. What are some of the items that you think you
Well, the biggest challenge is PPEs and I would say medication or pharmaceuticals
Okay.
to a greater extent.
Right.
But PPEs,
PPEs.
because there's a global shortage or global demand
Right,
for increased global demand for PPEs.
right,
And we have been blessed. Food for the Poor has stepped to the plate. They have assisted us greatly
right.
in providing some of these PPEs and equipment for us, ventilators and so on.
We were just in clusters across the island, but now the government, through the ministry, has declared a community spread. How has that impacted your region?
Well, it has impacted us because there's a greater demand now for our services.
Right,
In fact, for the past 3 weekends, we have been doing sensitization sessions in Montego Bay. This requires going out into the communities, quite a bit of public education, distributing literature, distributing PPEs, encouraging persons to wear masks, teaching them how to do that, distributing hand sanitizers, and so on. And we were able to do that, and we have been doing that over the past several months
right,
through the generosity, as I said, of companies like Food for the Poor.
right.
Here it is. These are some of the masks
Right.
that when we go out in the field,
Right.
we are able to give to persons, and there's always a great demand for that. But even greater still, and perhaps one of the issues that is highlighted is the challenges that are faced by our workers and others in our community.
Right.
We have seen where quite a number of persons have lost their jobs.
Oh,
In
wow.
this region, we're heavily dependent on tourism.
Yes.
Tourism took a blow.
Right.
We're trying to build tourism back.
Right.
And there is a domino effect because we're seeing workers, for example, whose husbands or wives would have worked in the tourism industry there without a job. So
Right.
the strain is on them.
What would you like our donors to assist you with now?
But of course, the PPEs can't be too much.
Okay.
Food items and care items can't be too much.
Right.
Ventilators and other machines, X-ray machines and so on, can't
Right.
be too much.
Right.
We know we get a good stock of medication from Food for the Poor from time to time. We're grateful for those as well.
Right.
And just about anything that goes into the running of a hospital or a public health facility, we'd be grateful for.
Okay. Thank you so much, Mr. Green. It is
Thank you so
indeed
very
a
much for
pleasure,
having us.
and we really appreciate you taking this time. So there we have it, Mr. Errol Green providing us with on-the-ground information in terms of the PPEs and the need. I'm now about to present to you Suzanne Moore, who is one of our directors here at Food for the Poor Jamaica. Suzanne is directly involved with the medical coordination and the medical items here in Jamaica. So she has on-the-ground information in terms of statistics to provide you with some information on the demand that is there that she's been getting as it relates to the need for PPE. Suzanne?
Thank you, Kivette, and thank you so much, everyone, for joining us today. As you heard in the presentation just now, that was covering just the western parishes. Jamaica has 14 beautiful parishes. We have 25 hospitals and over 300 health centers that are responding to this community spread of COVID-19. Added to that, we have over 50 children home, as well as several homes that is catering to our very senior and indigent population. So the need continues to escalate, especially at this time of community spread. So we really continue to be grateful to our donors for all they provided and look forward to receiving continued support for this very critical need. And just to share with you, here is another video highlighting the need.
I am Heather Davis, Nurse Liaison Officer, working in Nursing Administration and I'm here this morning representing the Senior Director of Nursing, Mrs. Helena Thompson. And we thank you for all that you've been doing for the nurses, because we have not a lot of nurses, but they work long hours taking care of the COVID patients. And we're appealing to the Food for the Poor donors for PPEs. We can never have enough masks, gloves, gowns, eye shields, etc. So we thank you in advance for what you'll be doing for us. Thank you very much.
The work that you support matters on a very individual as well as local level. The shipments of food and distribution are large in scale, but they're essential to supporting the health and well-being of individuals. Many who receive Food for the Poor aid have suffered great hardships and are faced daily with the challenges that poverty brings, exacerbated by the pandemic and recent natural disasters. We're about to watch a video of Mr. Montague and Mrs. Madden, who wanted to share their story and their thanks.
Today we're here on Walton Avenue with Miss Carol Madden and Mr. Dave Montague, recipients of food from Food for the Poor. And today we're just here to catch up with them and to see how the assistance from Food for the Poor has been impacting their life. Why did you need food from Food for the Poor?
It was a lot. Sometimes we are here, we don't have anything to eat. So we have to get something from them, get some assistance from them. That's grateful. So we can get something to eat sometimes and we depend on anyone else.
What about you, Miss Madden?
Yes. Well, I'm so grateful for the food from Food for the Poor because it really helped me a lot. And one time with here, when I don't see them come with the food, I can't wait. Because Mr. Douglas, really, when they come in a package, so Sakura, when the food not out there, because we don't really want to go hungry. You understand? Control with disability, you know, things that we usually do, we cannot do it again. Because I am really an equal by profession. So, you know, I'm really, really grateful to meet you people from Food for the Poor. And we share with others, you know, don't surprise. We don't keep it for ourselves, we share with others. And a lot of people really appreciate it.
What kind of disability do you have?
Well, on the 29th of October 2007, police shoot me up at Regent Street, and now I'm still having 2 gunshots. But a shot on my left chest, but in the right, and the other one rests on my spine. That is the reason for my disability, one that rests on my spine. But they did not remove any of the bullets them. I don't know why, but they are still there.
And what about you, Mr. Madden? What kind of disability do you have?
Yeah, well, on the 18th, 2018 of September, I was on a job on the farm doing some work, and I get electrocuted by a steel touching high tension wire. I don't have no foot, I don't have any hands, so I cannot do any work again. So I have to be here giving thanks, as I say again, give thanks to Food for the Poor, that we can eat something back.
It is very admirable that when you mention that you share the food that you receive from Food for the Poor, you don't just keep it for yourself. And even though you don't have much, you're still looking out for others. That is very, very admirable. So on behalf of Food for the Poor, thank you.
You're welcome.
And we will continue to serve you the best way we know how. And may the Lord bless you, and your baskets will continue to be full so that you can bless other persons in need.
Yes, and same go for the donors. And the donors over there, I wish they may never stop doing what they are doing.
And also the Food for the Poor will get it and can come deliver it to us.
Yeah, well appreciated for all of you. Donors, Food for the Poor, and you people also that make it possible.
Don't stop doing good in the neighborhood for people.
I agree with what Mr. Montague says, is don't stop doing good in the neighborhood. Food for the Poor works with a large range of different recipients. The sick, the mentally challenged, our elders, orphans, prisoners, and the homeless, as well as people that are physically challenged, as you saw today. Thank you for allowing us to do this work. I'd like to introduce Craig Solomon, who is the co-executive director as well as director of distribution. Craig knows the unique needs that underserved communities face in Jamaica and the way to respond to those needs. So Craig is going to give you a little rundown on that.
Hi, everybody. Glad to be here today. Welcoming everybody to take this virtual tour of Food for the Poor Jamaica and being able to work with our counterparts in Canada. We can't do it without you. So I just want to start off by saying thanks to all of you for logging in today, tuning in, and allowing us to present this to you. Food for the Poor Jamaica operates out of Spanish Town in a warehouse complex of about 100,000 square feet. With that, we are used to receiving and handling on average. Back in around 2018, we were handling close to almost 1,000 containers a year of anything from food to medical to wheelchairs to you name it. We were getting constant supplies in to provide for those in need. And those needs have not stopped. They've only seen them increase more and more, especially during COVID. When COVID first hit Jamaica, we noticed the numbers going up drastically in the world. Jamaica had nobody, but we started seeing the government put a lot of provisions in place to start protecting us from the possible spread of COVID. But with that came a large amount of job loss, which then turned towards increasing our numbers in terms of persons lining up at the gate because they had no food and they had no money to buy food. Those numbers increased to almost 80 to 100 people on a daily basis. And we had to start working with local churches in our area towards allowing them to socially distance and start receiving food from us. In addition to that, our phone calls increased. I mean, we're averaging over 900 calls from individuals asking for help or assistance on a weekly basis. And we're getting letters of over 150 letters weekly coming into us asking for help. And that help may be from asking for simple things such as mattress or a bag of food, right up to needing repair materials or asking for us to help them with a home or anything like that. And segueing into that, we're trying to build houses for everybody that is coming to us with needs. And right now with housing, we've built over 5,900. We're almost at 6,000 houses built in the past 7 years. And in addition to that, there's constant needs for the help with education, especially during this time of COVID. There's great need right now for tablets and laptops for people to learn remotely. They're also being asked to either add more schools or expand schools or repair schools or in some way create a better learning environment under this new situation that we're in. And to date, I think we've built over 250 schools throughout the island, and we're not stopping. And speaking of not stopping, I want to say that our staff here at Food for the Poor Jamaica has remained extremely dedicated towards serving the needs of those out there. And one of the first things that we decided to do was to focus on the safety of every staff member by providing them with the necessary safety equipment and gear and education in order to continue the work that that is so desperately needed by the island. And the staff has responded tremendously in terms of feeling safe and secure while going out there and doing the necessary work that is needed to be done. And with that, we also provided safety equipment and gear to our distribution centers and our sub-centers, and we provided support onto them as well. We never slowed down in providing that food network, which was so vitally needed. And that network spans island-wide with 34 distribution centers that are main hubs in which sub-centers are able to go to them and receive the necessary food and other items that they need. And those sub-centers, that's a span of over 1,500 churches and non-for-profit organizations throughout the island that are coming to our main sub-centers to get these needed supplies. And as Suzanne Moore mentioned, she mentioned of the number of hospitals that we serve, roughly 25 public hospitals and over 300 smaller clinics throughout the island, as well as our distribution network and connections and partnerships through the Ministry of Health and Wellness. Through that connection alone, we're able to provide, as you can see, provide the PPEs that are so needed and the safety equipment, as well as the pharmaceuticals that we give out. We're able to work with them to get that expansive distribution out to those in need and to the hospitals in the right way and the safest way possible. And lastly, I want to talk about our basket of care initiative and our giving initiative through giving these care bags to individuals. We recognized that a lot of our frontline workers out there, a lot of the custodians of hospitals and the lower tier employees that are still employed are still out there fighting the fight and doing the work that's needed in order to keep the country going and to keep the necessary services available. And so we initiated this care bag initiative in order to try and give them the necessary basic things like food, hygiene, supplies, vegetables, and things like that that would help them to continue onward with the work that they were doing. Because they may have a spouse within that family that may be out of a job because they're not as vital as they are, depending on the work that they're doing. And we've found that so many persons are finding that, and by doing this initiative and giving in this manner, it allows us to connect with the persons on a more intimate level while maintaining social distancing, but also it allowed for persons to feel a bit more secure. And doing this initiative, we noticed the numbers starting to decrease. We noticed less persons coming to the gate as often, less persons crying out for help as often. And in general, it slowed down the amount of phone calls from individuals coming to us on a constant basis, because they saw the initiative and the movement of food getting out there through Food for the Poor. So
Thank you, Craig.
I appreciate all that your donors are doing for us.
Thank you. We're going to continue with a panel discussion, including Craig, Kivette, Suzanne, and these are all leaders, community leaders, not communities, leaders from Food for the Poor Jamaica, and Camille Hudson. Camille is with the St. Catharines Municipal Corporation with the Welfare Department. She's the Assistant Inspector of the Poor and Homeless. She manages shelters and feeding distributions in shelters across Jamaica and is a strong partner of Food for the Poor. We're grateful she's able to be with us today. If you have any questions, now would be the time to put a comment or a question in the chat box, and we would love to respond to any of your questions. I'm going to ask Camille to begin by sharing a story of a meaningful experience with the work of Food for the Poor and how this work has changed since the start of COVID-19.
Good afternoon, everyone, and thanks for having me. Food for the Poor has been very instrumental to the feeding of the homeless and our destitute persons in Jamaica, especially in St. Catherine. As an inspector of poor, the Poor Relief Department is the social arm of the St. Catherine municipality. We have 5 programs, and the 5 programs we have indoor cases, so the indoor poor, those persons who are in the facility, the infirmary. We have the outdoor poor, those persons who are in the community that we go out to. And we have registered over 1,000 of those persons who we have. We have the homeless population, which we feed over 200, and it has grown for over 100% since COVID-19. We have the repairs to the pop-up, we call them the destitute persons home, and we have education for children of our registered persons. So for the homelessness program, we cater 3 categories it comes under. We have the homeless program, we have the street persons and persons who are in need. And we go into various districts, and what we're seeing happening now is that the increase of the number of persons who are coming to us for not only for care packages and raw food, but also for cooked meal, and what Food for the Poor is doing as it relates to energizing us with the necessary, we call it food supply, to ensure that these needed destitute persons within the municipality is properly fed. And one of the experience that I want to share with you, at about 7 o'clock one night, I got a call because we have temporary tents that we use now to cater to the homeless persons in various districts that we used to house them because they're on the street. So to protect them, we have a safe haven for them temporarily. And what happened, I got a call one of the evenings that there is this lady and how can I assist? And I readily, it was very late, and we readily accepted the challenge. And she came in. This person is an epileptic person supposed to be on medication. And because of the love and the care, with the help of the care packages, the food that we got, we were able to minister to her. We expand wider. We were able to find her family. And now she's reintegrated back with her children and her family. So that's one of our success story. Persons from Kingston, our neighboring parish, they have asked us to cater to some of their destitute persons. And can I tell you, persons came in wheelchair. We housed them temporarily under the tents that we have with the assistance from Food for the Poor again, with their care packages, the food. This young man started easing up in his chair. He assisted in caring for himself. And this is the opportunity that we have to work with Food for the Poor, doing a tremendous job to enhance the lives of our destitute persons in St. Catherine.
Thank you so much, Camille. That's great. We have a question from Cynthia. Cynthia, thank you for joining us today. So we have a question from Cynthia about the percentage of donations coming from local donors and companies. And I will ask Craig to respond to that, and then I will respond on behalf of the Canadian organization.
I'm glad
Both
you asked.
goods in kind and cash.
Okay, I don't know the exact percentages, but I can give you a rough estimate that locally, it's only recently that local entities have started coming to the aid of Food for the Poor in terms of donations in kind or cash. The in kind donations have happened recently because of COVID. We've started to see different companies come to us donating food items, water, soft drinks, and items such as that to help out with the food crisis that currently exists. And then in addition to that, with cash donations, we've noticed a lot of companies that are working with us towards donating initiatives, whether it be cash towards our care package distribution, or it will be cash towards supporting our housing program. You know, when it comes to building houses, as I said, we're building roughly 30 houses a month. And I would say that local donor support would be roughly, on average, maybe 2 to 3 or 4 houses at the most per month, as far as local donors' involvement in that particular program.
Okay, thank you. On the Canadian side, we have some great partnerships with gleaners across Canada. So Ontario Christian Gleaners, Okanagan Christian Gleaners, and North Okanagan. Gleaners are organizations that get donations of food from farmers, local farmers, and then volunteers wash, cut, and desiccate the produce and package it into 3-pound bags, and each 3-pound bag of dried soup mix can be used for 100 meals. So that's one of our great goods in kind meal partners. you know, we get most of the food that we bought this year was through cash donations. We were able to purchase 10 containers of rice and beans for Honduras, Jamaica, Guyana, and Haiti. You know, Food for the Poor US does a whole lot more than that. I can't even, I don't know the numbers, but I'm sure that I know they do 4,000 containers a year. I think about 2,000 of those are food, and then the rest is medical, etc. So, you know, every mickle make a muckle, as they say in Jamaica. So we are trying to do our best to support food distribution in Jamaica. And one other thing that we did do, we were able to use funds from Canadian donors and purchase local mattresses. And that's something that, you know, we are really trying to do, is to bring money into the Jamaican economy. So it's a combination of both, is getting funds, getting goods in kind, and then purchasing locally if possible. The food we purchased was purchased from Guyana, the rice from Guyana, the beans from Brazil. So doing our best to really support local communities that we're working in. Is there, I don't see any other questions. Kivette, would you like to tell a story, or Suzanne, a story about some of the different recipients who have received support from Food for the Poor?
Thanks, Sam. It is so touching when you hear, I mean, we watched the video earlier where we saw 2 recipients who received food from Food for the Poor, and they didn't just keep it to themselves, but they also gave it to their neighbors. Mm-hmm. And this story is multiplied across the island as we serve the persons, because being on the ground and being in the community, we recognize that we give them a food package and that would be possibly able to feed 4 or 5 family members for a month. However, they're able to provide additional or support their neighbors because they are not the only ones in need. I remember going to a community and we didn't have enough food package for distribution. We actually ran out. And when we were given the last set of packages, I remember this lady said to me, "Don't worry, I will share with my neighbor, because I do know that when she has, she gives to me as well." So it just goes to show the heart of the people, and the need is out there that is so great. But at the end of the day, they still each one reach one, and everybody is your neighbor, be your neighbor's keeper. So it's we can never say we have enough, because no matter what we get, it is always needed even more. So for me personally, being able to reach the need, serve the persons, see them on the ground, and recognizing that out of the little that they have, they are also stretching to other persons.
Okay, thank you very much. Suzanne, can you talk about the different community organizations that we are supporting with feeding programs, as well as the smaller clinics that we support?
All right, so we have, as I said, the numbers are interesting. So we have NGO clinics, NGO operations. So we have areas that are serving from the church communities, from the civil societies, those NGO operated facilities that we offer services to. Food for the Poor, in a short answer, is that we serve every entity serving the poor in Jamaica and needy. But they're right across. So whether it is that their persons are in prison, whether it is that they're in hospitals, whether or not they're in infirmaries, as Camille spoke about, whether or not it's a church that is doing outreach into the community, whether it is the social arms, the Red Cross, the local entities that usually provide support, that's where you find Food for the Poor providing operations. And because these areas are in the community, they're on the ground. And so it allows us to be able to spread and reach right across the 14 parishes. So our reach is right across the island. When it looks at the children's homes are about 50, and they're all getting support from us. And they're getting support in terms of not only the personal protective equipment, but they're getting food on a monthly basis. And then, of course, when you look at the numbers that have increased, and you've heard it from all the presenters, and that is something that we're always able to say because we're all across Jamaica. And what we've done also is what is so amazing, and our EDs are on this call can share with you, is that what we're actually doing is that not only are we working through these multiple agencies across the island, we are actually in the field actually doing the distribution. So you'll find us in a trench town as we were last week. You'll find us this week we're going into Clarendon, then we're going to be in, and so the list continues. So not only are we working through our partners, we are physically on the ground, and you would have seen in the earlier video, for those who joined us early, would have physically seen us in the field actually providing this sort of support.
Wonderful. Thank you so much. I see we have one question from Sean, and he asked more specifically, how do food packages get to those in need? Do people come to you? Do you deliver to them? Do they come to the depots? Is it both? So,
I think Susan may have alluded to that when she was just speaking, but
right.
Sean,
Yeah.
I'll tell you, the food packages themselves have been for us a challenge because of COVID. So we've had to do it very strategically in how we develop that type of distribution. It's all done through coordinated partnership efforts, whether it be with a school. We've done it in a school parking lot, and where we had a number of individuals that were told to come on a certain day. They were set up so that way they were distanced apart from each other. And we had them coming to the parking lot distance from each other. We're calling names so that so many would come at a time, go through a distribution line where they're collecting from us. We're all wearing masks and we're giving out the food. The biggest challenge is, as you see in the United States, when somebody does a food distribution, everybody gets to come in a car, drive through a nice big open parking lot, and everybody is socially distancing. We have to create that ourselves because the majority of the persons are on foot. And the packages that we give are a lot different than in the United States. When somebody gives you a food package and you see that small package, I know that's going to give them food for maybe a week or so. We are seeing individuals that we may not see for months on end. We're giving them a wheelbarrow's worth of food. Literally, we have them, we're taking wheelbarrows and loading it up with food bags that will give a family of four, roughly, depending on how they eat, roughly a month's supply of food. So it's done through coordinated efforts through churches and different food groups to get the food packages out there.
Great, thank you. I had one last question that actually Hyacinth had asked. She has somebody that she's supporting in Canada with cash donations, sending money, which is always a great way to support people in Jamaica, but also wondering how this person can be supported by Food for the Poor. I mean, there's so many needy. Is there somewhere on your website that people can get instructions on how to avail themselves of your food and etc.?
You want me to answer?
Or Kivette?
Okay. Well, we, on our website, if someone is in need of food, we ask persons to contact us directly.
Okay.
By dialing our 876-984-5005 number. Okay. Once they call that number, then they're put onto one of our very efficient customer service representative, who will then channel them through the proper process for them to get access to the food that is necessary.
Perfect. I see that we are at about 1:45, and I just wanted to, I think, wrap up at this point. I think if anybody else has a last question, but if not, I just want to say thank you so much for coming. We really, really appreciated you coming. We have one last call to action. You know, the reason we're here today is so that we can do more, so that we can buy more food, ship more containers, send PPE, purchase PPE, and so if anybody has the opportunity to support and to tell others to support, we really appreciate it. Craig, any last words?
Really, Sam, we appreciate anything that your donors can give. Every nickel make a muckle, one coconut filled basket. You know, we really and truly just want everybody to see the need that's here and support us in any way possible. And we'll work with anybody to facilitate whatever they're wishing to do in terms of supporting the poor that we're serving.
Okay, great. So if you need any follow-up, if you have any questions, if you would like to make a donation, we have our website, but we also have a phone number in Canada. It's And I'm going to tell you it here, 921-4008. So again, thank you so much, each of you, for coming. And so we're really appreciative of all that you do so that we can do this work. And we look forward to seeing you at our next virtual event, which we're hoping will be a house build. And we have heard rumors that Shaggy might be involved in one of them. So you keep an eye on what's going on. And thank you. Stay safe and have a wonderful Christmas and take care. Nice to see all of you. Thanks for coming.
Thanks.
Bye.